With polls showing Obamacare increasingly unpopular with Americans, the president continues his campaign to try to convince Americans that his health care overhaul is right for them. Well, under the plan, starting October of this year, people are going to have to compare between complicated plans and then choose the one that's right for them. But what if you don't have to pick any insurance at all? What if you just paid your doctor directly for the services that he or she provides? Does that sound too expensive? Well, my next guests say bypassing insurance and all the red tape actually keeps administrators and the bureaucrats out and makes health care more affordable. Joining me are three primary care doctors who offer alternatives to Obamacare. Dr. Michael Ciampi, Dr. Doug Nunemaker, and Dr. Marcy Zwelling. Good to have all of you here today. Thanks for joining us. All right, let me start with you, Dr. Ciampi. You recently took what some might consider a pretty radical step. You stopped all kinds of medical insurance in your practice, and you now just take patients and you tell them what the prices are. It's very open and transparent. What motivated you to do that?
Well, Governor, thank you. What's going on now, medicine is really devolving in terms of the financing of it. And I did this based on both moral and economic grounds. Economically, what's going to happen in Obamacare with the accountable care organizations, this is the HMOs of the 80s and 90s that we all hated, and actually even worse, because what they're going to do is give hospitals or accountable care organizations money and say, take care of Medicare patients. If you spend less, you get to keep more money, but if you spend more, the hospitals and the doctors have to pay to take care of these people. And that's just financially untenable for a primary care or really any doctor because the margins are so low now. And on moral grounds, if you incentivize an organization to take less care of someone, that person will get less care. What we did was we decided to post our prices in the office, online, opt out of Medicare. We don't take Medicaid or private insurance. We post the prices, we cut our prices in half, and we have people come in, they get the service that they ask for, they pay on the way out just like you would at the deli or at your mechanic or your grocery store, and the transaction's complete. It's a win-win for everyone.
I love that. I'll take a turkey sandwich and the appendectomy. That'll work. You know, one of the just follow-ups, did you lose patients when you did this? Because this is a big step. I mean, that is a radical departure from the way most people practice medicine.
It is radical. Well, it's kind of ironic that you pay for a service and you get it and you leave. It's kind of scary that it's considered radical, but we did have several of our Medicare patients decide to go elsewhere because Medicare will not allow them to get reimbursed for our services, which is very unfortunate. And some of our folks that have HMOs with very strict rules, they were not able to get referrals from me because I'm not contracted with them. But what we're seeing is people that have no insurance whatsoever or high deductibles are absolutely thrilled. I'm seeing people now that haven't seen a doctor in years because they couldn't afford it before.
Dr. Nunemaker, you're in Kansas. You have a similar but a little different approach. People pay an annual fee, and then they access into a network. It's like concierge medicine, something that I predicted 5 years ago would be the coming thing, and it has been. Tell us, when a person pays the fee, I guess it's monthly or annual, what does that access them to?
Basically, we realized when Dr. Umber and I started our clinic, we realized that the healthcare system is irreparably broken, and we had to throw as much value as possible at that membership. So what that actually avails them is truly unlimited access to office visits, home visits, work visits, and even technology visits, which are cell phone calls, texting, email, Skype, Twitter. You also get access to wholesale medications and lab work at up to 95% discounts.
Whoa, 95% off of what it normally would be. I mean, that's a big discount. That's huge.
Well, yeah, something, for example, a cholesterol test may be charged $60 to $90. We charge $3 because that's what it costs us.
Wow.
We also do all of our procedures are done for free as well. They're included. So if you need an EKG, you don't have to worry if I'm going to make $25 doing it. I'm going to do it if it needs to be done, and it costs me 40 cents in little electrode pads to do it. So if I need to put stitches in, we also do that for free. Did that just a couple days ago for a little boy. Strep throat testing, urinalysis. Anything we can do in the office is included to make that membership more valuable. But to be honest, what's really, the part of the system that was really broken was insurance. And we decided to get out of it, but we realized that insurance is still necessary. So what we've been able to do here in Kansas, and hopefully on a grander scale, because our model is affordable to the masses by design, we've worked with insurance companies locally to write custom-designed, high-deductible insurance policies that have saved, in fact, saved one family $1,000 a month with the membership of our clinic, and one small company here in Wichita stood to get back approximately $250,000 in the first year utilizing an ERISA plan. One of the local companies even has seen what we can save them, and they will count our membership towards the deductible. So now your money's working twice as hard for you. It's just amazing what you can do when you utilize the free market. Seeing people say that we're radical. Mechanics work for cash, pharmacists, veterinarians, electricians, plumbers. There's no reason that physicians can't do the same.
Well, Dr. Marcy Zwelling is also with us, and we're going to ask her about some of the changes she made in her medical practice, and we'll keep Dr. Champion, Dr. Nunemaker with us as well. Fascinating stuff. It may be the alternative you're looking for Obamacare. And how important is it for you to keep your medical records between you and your doctor? Because under Obamacare, your information is going to go into a government-run computer system. And we all know how secure that is right now. Stay with us. We'll be right back.